are starting ASCO, the biggest medical meeting in oncology, with doctors coming from all over the world. And now I have the pleasure to talk with Dr. Antonio Llombart, that is from MEDSIR and also a medical oncologist based on Spain. Dr. Llombart is presenting a very important study here at ASCO, the PRIMED study. Doctor, can you please tell us a little bit about it?
Sure. This study is about patients treated with sacituzumab govitecan, that is one of the new ADCs, antibody-drug conjugates, that is changing the behavior of those patients. The study is in patients with triple negative, advanced disease, who have progressed to prior lines of therapy. And the particularity of this drug is that we combine it with different approaches to reduce the toxicity profile of the drug. So as we know from the phase 3 study, sacituzumab was a very active drug with impact in survival, but with some toxicities, two particularly relevant: neutropenia and diarrhea. And what we have generated here is a study where we introduce prophylactic G-CSF to prevent neutropenia, as well as prophylactic loperamide for just 2 days, each of them, after every dose. And what we have observed when we have done this primary analysis for the primary objective is that the efficacy in controlling neutropenia as well as diarrhea is very high. Okay, so the incidence of grade 3 for neutropenia in the first 2 cycles with this combination is 6%, so very far from the 35% that we observed from the phase 3 trials. As well, we didn't identify any febrile neutropenia, and also diarrhea dropped very significantly, very few patients with grade 2, grade 3. So finally, that's a way to say we can prevent these toxicities by introducing this prophylactic treatment that will grant us to maintain the doses and to expand and extend the duration of the treatment. So probably on benefit for the patient, because we will achieve the major benefit with the drug.
So it's great news for patients with breast cancer that now can use this drug with more tolerability. And also you're going to have like an extension of the trial presenting at San Antonio.
Yeah, as you know, this study was recruited very fast. So we have just been able to analyze the primary endpoint that was this efficacy or toxicity profile within the first 2 months. But it's true that our feeling is that we will observe an impressive median PFS because the population that we included, but particularly this lower toxicity profile, means that those patients have had less dose reduction, less dose delays, and also less interruption of treatment because of the toxicity. So we will present at San Antonio the median PFS for this population that we expect that it will be much superior to what we have observed in the phase 3 trials.
Very good, congratulations. And we are Grupo Oncoclínicas at ASCO 2024.